Hey, in this video we're going to talk about the 3 simple yet little known ways to improve thoracic mobility once and for all. So as always, don't forget to subscribe to our channel below. You'll get first access to exclusive weekly content where we'll go into this kind of content in a lot more detail. You'll also get free access to our CPD courses as well as become part of the online community. Now, if you don't know me, my name is Dave O'Sullivan. I've had the pleasure of working in professional sport in 2 World Cups. Worked in professional sport for over 13 years alongside building up a go-to private practice. Okay, so everything you're going to learn here we use both in professional sport but also in private practice with our non-sporting patients. So you can use these concepts, these techniques in both populations. So the thoracic spine is the middle segment of the vertebral column. But what I want you to really appreciate here is the articulations with the heads of the ribs. So if we go to muscle of motion here, very kindly allow me to show some of their clips. So again, I'm not going to show all the clip, but I want you to understand the importance of where the ribs articulate. So you can see here the ribs are articulating into these facets here, and I want you to appreciate the importance of that movement of the rib cage. Okay, so again, muscle of motion doing a really great job here of demonstrating that. Okay, so that's something we're going to need to be really aware of. Okay, is that rib cage mobility is going to influence the thoracic spine as it directly attaches to it. Okay, so that's the first thing. Okay, and then the second thing, okay, is I want you to appreciate the importance of the diaphragm and that range of motion that has to go through. Okay, so when we get the person to breathe in, okay, if I go back to here, okay, so when we breathe in, the diaphragm is going to shorten or flatten. Okay, the rib cage is going to elevate. When we exhale, the diaphragm has to lengthen. Okay, so when we need that retraction and depression of the rib cage, as the rib cage comes down, we want that diaphragm range of motion as well. Okay, now the other big thing we want is we want all of the muscles that attach to the rib cage. They're also therefore become important if we're looking to improve thoracic spine mobility. So in everyday life, why do we care about improving this for our patients? Well, if you want to put your socks on first thing in the morning, if you've got a patient with low back pain, very often what I see is that they really lack that thoracic mobility. But said another way, they really lack the ability of the rib cage to depress and retract. Said another way, they really lack the ability of the diaphragm to go through full range of motion. Okay, so also then throughout the day, you and your patients are going to go through this process of having extended thoracic spine to a flexed thoracic spine. Okay, regardless of what way you sit. Okay, so we get a lot of low back pain patients. They'll be sitting bolt upright. They'll be told that they have to sit up straight. That is their posture, and what they're actually doing is they're not allowing the rib cage to naturally depress and retract and naturally allow the diaphragm to lengthen. Okay, so they're restricting the diaphragm going through full range of motion. That's going to help allow the relax the low back muscles, and very often we'll actually get a lot of our back pain patients sitting more like this to get comfortable. Okay, and then the last thing I want you to understand is that the costal cartilages are elastic and stretch and store energy, especially during inhalation. Okay, so these costal cartilages here, very important. Rugby players, take a lot of trauma to these, and we can see firsthand the effects that's going to have on the body. Now, here's where it gets really interesting. You can see the importance of that rib cage. Okay, so when the rib cage goes forward, okay, we straighten up, for want of a better word. Okay, or we lose that thoracic kyphosis. When the rib cage goes backwards, we increase our thoracic kyphosis. Okay, so again, the rounding of the mid back. So you can see that the rib cage translation is very, very important, and it's essential, essentially, if we want to talk about thoracic mobility. And it also affects the pelvis, which is going to affect the hip, and it's also going to affect above, which is the shoulder joint. Okay, so again, ribs, you can see here the rib movement. Okay, again, makes sense. Younger people are going to have more rib movement than older people. Okay, and especially up to kind of ribs 5 and 6 here, we start to see the peak. Okay, so rib 5 has the most movement, and again, when we lift our hands overhead, that's what I should have said first, apologies. We can see that the ribs have to move, especially ribs you're starting to get increased movement here from 2-3 all the way through down to 7-8. Okay, so again, we really need that rib cage mobility. and the ribcage mobility, that's going to be impacted by the intercostals. Okay, so I'm just on muscleemotion.com here, and you can see those ribs, they really need to move. Okay, then we can start to look at the importance of the other muscles such as the obliques. Okay, so you can see when I thoracically rotate here, okay, we're going to need the external obliques to shorten here, okay, and the internal obliques on this side. So said another way, your external obliques have to lengthen on this side, and your internal obliques have to lengthen on the left side to rotate to the right. Okay, and then you can see as I rotate, you can see how I need that diaphragm to go through a full range of motion as well. Okay, so again, we want to improve thoracic mobility now. We want to be looking at improving ribcage mobility. How do we improve ribcage mobility? We want the muscles around the ribcage to go through a full range of motion. So we want the diaphragm to go through a full range of motion. We want the obliques to go through a full range of motion, specifically external, internal obliques. Okay, and then we're going to give ourselves the best shot of getting long-lasting thoracic mobility. Because if you just do some drills but we're not influencing these tissues specifically, then we could be getting short-term relief. Okay, so again, it's all about long-lasting changes. So you can see as I go to the right here, okay, but if I want to increase thoracic mobility to the left, I want you to notice how the external oblique and internal oblique have to lengthen. Okay, so you can see here that it's lengthening. Lovely videos by Muscle Emotion. Okay, so you can see as I want to thoracically rotate to the left, I need my right internal oblique to lengthen, and I need my left external oblique to lengthen. I'm going to show you some good mobility exercises shortly for that. Okay, so you can see now, hopefully, that if you are doing maybe your foam rolling exercises, or you're doing various thoracic mobility exercises, but you're not specifically targeting diaphragm range of motion and the internal external obliques, then you're probably going to get limited value. You can see this study here affects the diaphragm stretching. Again, this is just short-term results, so we need to take this study with a pinch of salt. Okay, you can see here that it increased the cervical range of motion and flexibility of posterior chain, and then ribcage excursion. Okay, so again, it gets diaphragm stretching, gets the ribcage moving. Okay, so as always, I want this to make sense. I want you to be able to take this information and I want you to apply it in the real world. So if it's making sense so far, just pop a yes in the comments, followed by your biggest takeaway so far, and what you're going to implement in the clinic tomorrow, because I've got no interest in teaching you stuff and getting all fancy and wowing you. Okay, I want you to understand the why behind everything you're doing, so that you have confidence and clarity to take action and get results. So if this is making sense so far, pop a yes in the comments and let me know your biggest takeaway so far, what you're going to be starting to look at in the clinic tomorrow with your patients. And as always, special thanks to Muscle Emotion. I appreciate them allowing me to use their software to demonstrate for my teaching purposes. And if you want to look at that software to understand movement and make sense of movement and understand the why behind everything you're doing, then you can head over to muscleemotion.com, and they've also been kind enough to give me a special discount code. PSP20 will get you 20% off. So really grateful for them to allow me to use their videos to help my teaching. Okay, so let's get into our thoracic mobility exercises. Okay, so again, when we look at thoracic mobility, just a couple more clips, so I want you to appreciate what we're trying to target here. Okay, so again, I'm not necessarily, now you could use this exercise, okay, but when we rotate to the right here, okay, we're lengthening our right external obliques. Okay, so our external obliques come this way, our internal obliques come this way. So when I rotate to the right, okay, I lengthen my external obliques. Okay, so I'm just going to get at display lovely videos from Muscle Emotion. Okay, so you can see both in the transverse and the frontal plane here. Okay, so again, the obliques are very important, and the thoracic spine, it moves in 3 dimensions. So again, it's not just about rotation, and very often, you know, if you're doing a lot of rotation, you might actually be struggling in lateral flexion. Okay, so again, look at the amount of lengthening that we need from them. Okay, and in functional terms, you can see the importance of it for shoulder mobility. Okay, so you can see the amount of movement we need to help that shoulder. So again, that apprehension test, we need that ribcage to be moving. If that ribcage isn't moving, very often you take someone in the apprehension test, we're going to wind up that shoulder very early from my experience. Okay, so again, we need that full range, and I want you to look at the amount of translation of that ribcage and the reaction of the shoulder joint as well. Okay, so with low back pain patients, I talk about this, the importance of ribcage depression, but also ribcage protraction and elevation. So we want the ribcage not only to depress, but we need that ribcage to come up like this. Okay, so again, when I was starting out understanding this stuff, I studied a lot of courses like Posture Restoration Institute and stuff like that, and they talked a lot about depression. But actually, the more I understand this stuff now, we need this. This is so important. It's the protraction of the ribcage that I actually find that I'm working on more these days. Okay, so again, we want to look at that. This is my mentorship program. You can assess the ability of the ribcage in many ways. You can have a look at their breathing. Okay, so you can just get them to exhale and see is the actual ribcage moving. Okay, and then if it's not, or you want to help it, okay, you can do some hands-on techniques. Okay, so again, we can influence either the intercostals, we can influence the obliques, we can influence the ribcage, we can stretch the diaphragm. Plenty of different ways to influence that. Okay, so if we get into some of my favorite exercises, so just to recap so far, we're going to have a look at restoring the ability to lengthen the diaphragm. I'm not going to go too much into that. Okay, I've written a blog on that here. Okay, you can go into that to learn more some of the breathing exercises, okay, that I've learned from the likes of Posture Restoration Institute and other people. I'm not a PRI therapist. I don't treat using the PRI methodology, but I still think that there's a lot of value in some of the stuff that they use. Okay, so feel free to go into that. I'll link that in the show notes. I've talked a lot about the diaphragm mobility before, so what I want to give you is a couple of other stretches. So the first stretch we're going to do is the internal oblique. Okay, so again, these are some of the ways I prefer to stretch the internal oblique. Okay, so what we're going to do is we're going to get our right hand, we're going to put it on our left bum cheek. Okay, that's going to rotate us to the right. So when I rotate to the right, I'm going to stretch my left internal oblique, remember, but I'm also stretching my right external oblique. Now what I'm going to do is I'm going to slide my ribs forward along the wall. So that's going to get that anterior translation, okay, first and foremost, which remember, that's going to decrease the kyphosis, which is going to increase thoracic extension. Okay, and then I'm going to reach my left fingers to my right bum cheek, and then that's going to drive my elbow up. That's going to elevate my rib cage with a bit of rotation, okay, and a bit of frontal plane as well. So I'm getting 3 planes here all lengthening at the same time. Okay, so I'm just reaching to my bum cheek. Okay, so I'm getting that anterior translation. Okay, I'm getting a little bit of rotation because I've rotated to start with, and then that side flexion. Okay, so I'm not maximally lengthening one plane. Okay, so you can see in these videos here, this is obviously maximizing your frontal plane to stretch your external obliques. Okay, I'm more focused in my exercise with actually getting everything working together. So if we just look at that once more, okay, so you're going to get that rib cage to translate forward, and then you're just going to reach, and then as always, if you want to help the diaphragm to shorten here, just get a slow inhale, okay, because again, we want the diaphragm to come down, we want to stretch the pelvic floor here as we inhale. Okay, so you can see now I'm getting a lot of movement. It's not about the hip movement, okay, it's about the intent to move through the ribs there. So I'm going to feel a big stretch to my internal obliques on that exercise. Okay, then the other one to get the external obliques, okay, so to stretch the, okay, so these are just some clips I put together for my mentorship therapists. Okay, so to get the external obliques, okay, so again, remember, when I rotate to my left, I'm going to stretch my left external obliques, okay, and then again, we're going to encourage that, so we're going to encourage that lateral flexion and elevation as well here. Okay, so again, we're just taking up the slack, and then we're just lengthening those tissues there, and I'm going to feel that a little bit more here. And if you actually feel tighter on your right internal obliques, you might actually notice that as well. So that's what I'm saying here, you're picking up the sensation of that as well. So you're just going to come into this position, you're reaching your right hand down to your left bum cheek, okay, and you're reaching down, okay, and you can see the reaction through the pelvis as well. Okay, so they're two of my favorite exercises that I give to a lot of my athletes and patients with back pain. Okay, and then as always, the key thing we need to understand is that we want to make sure that this can work in real life. So the key phrase I like is increase core contractions peripherally to decrease core contraction centrally. So what I mean by that is a lot of people I see, they lack ribcage mobility because it's a reaction, that a protective strategy that the nervous system puts in place. Okay, so again, if we don't have good intent through our peripheral limbs, such as our hands or our legs, very often I see a lot of people that they lock the back up, for want of a better word. Okay, so what we want to do is we want to make sure that we take our patients through graded exposure. Okay, so again, in my step-by-step system, ribcage mobility, it's the start of the process. Thoracic extension, it's the start of the process. But to keep it, we need to get everything working together. Okay, so one of my favorite exercises for that, okay, is what I call a slouch exercise. Okay, so all we're going to do here is we're going to get our ribs over our midfoot. Okay, we're going to slouch down, okay, which is going to help us, okay, get that flexion, thoracic flexion. Okay, now we're going to keep the intention of midfoot, and I've got a good core contraction of my knee here, okay, peripherally through soleus, working with hamstring, working with quads. Okay, and then this is, you can see I'm really facilitating that extension now. Okay, but the key thing here is I've got my nervous system is going to allow me to mobilize my rib cage because it knows that I've got good intention with my legs. So very often you'll see people that they're using their back, okay, a lot, because they don't have intent through the leg. Okay, so again, I'm hip extending here, okay, which then is going to mean that, okay, my low back muscles aren't going to have to do too much, so I won't rib flare. Okay, so again, if you use your low back a lot here, what you'll see is you get a lot of rib flare, okay, but you won't get a whole lot of rib cage protraction. So the rib cage will go up, but it won't go forward. So if you just watch this video, you can see the rib cage is going to go forward, okay, as I continue to reach. Okay, so it's not just up, the rib cage needs to go forward to get thoracic extension through the mid back. You'll really feel your upper fibrous iliocostalis work with this exercise. Okay, so rib cage forward over the midfoot, then we're going to slouch out to get flexion, and then we're going to get up here. And this is the key that a lot of people are missing. They're spending too much time doing all of their exercises here on the floor when real life happens up here. Okay, this is real life. Okay, so this is most physio exercises, most thoracic mobility exercises. This is real life stress on the body, which is why they do the exercises and they feel great, but then 10 minutes later they lose their thoracic mobility again. And that's why we have to look at the person first and the symptoms second. So the 80-20 rule at the go-to physio, we're going to spend 20% of our time desensitizing the symptoms. Okay, respect pathology, yeah, we'll appreciate that, but we're going to spend 80% of our time giving back an ability to tolerate load through other parts of the body that we may be thinking isn't doing its job. Now that might be including increasing range of motion, or as I said, just increasing the ability to tolerate load. And I use that word load tolerance, or that phrase load tolerance, because a lot of the time this is about coordination. It's about showing the nervous system it's safe to tolerate load again, rather than just strengthening exercises. Okay, so it's a far more about the ability to tolerate load, just like stretching. We tolerate the ability, that sensation when we go into these range of motions. Okay, so it's the exact same process. It all starts at the subjective assessment. Okay, so just like in the mentorship, we want to have a solid. So this is module 4, which is we start to look at the lumbar spine patients. Okay, but actually in module 1 we spend a lot of time in the subjective assessment. Okay, so again, is there anything in there, is there any emotional stress or trauma in their injury history that may have affected their breathing rate, which is affecting their range of motion through the diaphragm, which is affecting the rib cage mobility, which is affecting their thoracic mobility. And then we want to build that graded exposure up so that we increase load tolerance both physically and emotionally, okay, at the highest levels of the graded exposure program that we need to get people back to. So I see a lot of people, they do their thoracic mobility exercises on the floor, they do the breathing exercises, that's great, but where do they need to be successful in real life? Okay, and that's the environment and the positions that they need to go to. So as I said, most people are here doing these fancy exercises, whereas actually in real life stresses starts here. And that's why we have to bridge the gap from low level to high level rehab, and that's exactly what we do in the mentorship. Okay, again, we start with our assessment, our hands-on treatment, but we want to start getting that mobility, and then module 7 to 12 in the mentorship, they bridge that gap specifically from that kind of session 3 or 4 patient slump all the way up to the high level rehab. And that's why you need a full 8 pillars of the go-to therapist. You cannot just rely on one exercise or an exercise. I promise you there'll be a patient that'll come through the door and they will not respond to that exercise. It's happened to me time and time again. My favorite exercise. So the most dangerous number of rehab, as well as the most dangerous number of business, is having one exercise or one hands-on techniques. That's why you have to understand the why behind everything you're doing. You need to make sense of the patient's story, okay? But in the subjective and objective, communicate the problem, the solution, and the plan. Then we need to design that plan that's going to get it back to the actual the meaningful results for them. We need hands-on treatment, yeah. Sometimes we don't, but most importantly is we need to progress or regress our patient at any one time to bridge that gap from the high-level rehab, and then when our nervous system is happy to tolerate load, then we can start to strengthen them, okay? But a lot of times the motor adaptations, when there is pain, our brain is very clever, it'll avoid loading certain tissues. So that's where it's not just about putting them into an exercise and go, right, lift that weight, because I can guarantee I work with rugby players who are very, very strong, and I see rugby players avoid loading areas all the time. So you give them a weight, they're great, they'll cheat, they'll find ways around it. And that's where we have to have that graded exposure program. Okay, so I hope that was useful. Next steps, if you want to learn more, if you want 14 days free access to my shoulder return to play course, if you haven't availed of that already, head over to www.thegotophysiocom.com/free, and I'll give you 14 days free access there. You can see how we improve ribcage mobility, but then we take the patient through the graded exposure program. Okay, as always, thanks for listening. Let me know your comments, let me know your biggest takeaways in the comments below, and if you find this content valuable, let me know and I will be sure to make more content very, very soon.